In the past 2 years, the VFW has also worked to evaluate the VA's ability to care for our veterans. The VFW did this work through the lens of our members to ensure that our recommendations are veteran-centric and aligned with the views, the preferences, and the experiences of those the system was created to serve. Now, the good news is that VFW members across the country are noticing improvements. In the VFW's latest healthcare survey, nearly 60% of responding veterans noticed an improvement. Some even said that their VA facility is not in need of improvements. Veterans tell us that the VA has improved its customer service by being more caring and more friendly. Veterans also reported waiting less time for their appointments, and they commended the VA for making several changes that have improved the overall patient experience. But to be clear, the VFW is not content with maintaining the status quo. However, as high users of the VA healthcare system, we know that implementing system-wide changes takes time, which is why we are pleased to see that the Senate confirmed Dr. Shulkin unanimously. And we look forward to working with Secretary Shulkin to ensure he is able to succeed in what has become the most scrutinized job in this country. The VA still has a long way to go. It needs to hire more providers, train its employees better, and hold the wrongdoers accountable, and get a handle not only on the reported backlog, but on the entire workload, and it needs to update an aging capital infrastructure. Access to outside doctors when the VA isn't able to care for veterans in a timely manner is part of the solution. However, veterans want to fix, not dismantle, the VA healthcare system. And we thank Congress and the VA for making several of the VFW suggested improvements to the Choice program. But it continues to face several challenges, and it must be improved before it is made permanent. Congress must eliminate the secondary payer requirement under the Choice program, and Congress must fix how the VA obligates funds for community care. Congress must authorize the VA to enter into provider agreements so that it can stop losing 200 community nursing home partners a year. And finally, Congress must repeal outdated laws that hinders the VA's ability to share medical documentation with private sector doctors. Congress and the VA must take the lessons learned from various community care programs and create a single, sustainable program that integrates the private sector into the VA healthcare system. The VFW has supported a number of bills that would move towards this goal. However, Congress's self-imposed budget rules have kept such bills from becoming law. The Choice program is set to expire soon, but Congress has not acted on a permanent solution. Instead of waiting until the 11th hour, which will limit the VA's ability to serve veterans, Congress must provide the VA the resources it needs to continue this important program under the existing authorities. Congress must also pass strong accountability legislation to ensure Secretary Shulkin is able to discipline employees who endanger the lives of veterans, period. But along with the authority to fire bad employees, the VA also needs the ability to quickly hire, to properly compensate and retain high-quality employees. Congress must improve VA's hiring and retention authorities